Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental of Springfield in Springfield, Virginia. Today I wanted to talk to you a little bit about acute infection, which can be life-threatening. So on rare occasions, if something's untreated for long enough, either a cavity goes completely through the tooth into the nerve and infects the nerve and goes out the root tip into the bone and makes an infection in the bone, or something gets trapped under the gum closes off on the top and it swells. If you have acute pain or swelling in the mouth, there's probably a pocket of pus that's growing and resorbing your bone. And the more it spreads, as soon as it gets through the bone, if it's on the cheek side, it's going to pop out and usually drain into your mouth. But if it gets trapped in the upper jaw up, it's going to get in your bloodstream. There are no valves. Most of the body, we have these back valves that prevent backflow of venous blood, so it only goes one way to the heart. Up here, there's no valves, and so the bacteria can go through the veins in the blood supply into your brain where you can't get any antibiotics in there, and people basically get an infection and die from it. It's very rare. It only happens a couple times a year, and once every couple of years when it makes national news, I all of a sudden have a bunch of people call me and say, do I have an infection? I'm like, no, you're fine. I just saw you a couple months ago. Are you swollen? No. Okay, you're fine. But if you do have pain or swelling, if it's in the upper jaw, it can get an infection in your brain. It can kill you. In the lower jaw, if it goes through the planes of the neck and swells enough that it closes off your airway, it can also kill you because you can't breathe. So these are not conditions you want to mess around with. These are not conditions that respond well to antibiotics either. So the antibiotic might be a Band-Aid. It might save you a day or two. There's no way to get the antibiotic into that pocket of pus. There's no way to get the antibiotic into the tooth. There's no blood supply there. It might help contain it. It will not treat it. The only way to treat it is to physically remove the cause of the infection, which is usually the tooth, or to get into the infection and clean it out. So at that point, you're either looking at an extraction, a root canal, or like cutting into the pocket of pus and draining it out. So these are not things that can be done at the emergency room typically, unless they have a oral surgery department there. These are things that you need to come see myself or another dental provider about, so that we can not only treat the cause of the infection, but then also get you some antibiotics on board so that it doesn't become a life-threatening condition. So these aren't fun things to deal with. They're usually painful. They usually involve swelling. If you have any pain, swelling, or pus in your mouth, please give us a call, 703-451-4500. Thanks so much.